Welcome to the last video of the Global Commission's Dialogue series. Today we have the pleasure to have with us Helen Clark, member of the Global Commission on Drug Policy. She's former Prime Minister of New Zealand and administrator of the United Nations Development Programme. She has been worldwide recognized champion of inclusive development and a fierce defender of the rights of the most vulnerable. And Zeeshan Ayyaz from Pakistan, with drug use experience, has been working in the last 12 years for the rights of people who use drugs in his country. Thank you both for being with us today. May I ask you, Helen, if you'd wish to start? Thank you.
Well, great to have the opportunity to talk with you, Zeeshan. And
thank you, ma'am.
I'm aware of the work that you do with the Middle East and North Africa network of people who use drugs. We know that you're operating in a region where often drug policies are very repressive, with a lot of implications for those who are using. How about telling us a little bit about the issues in the region, and including, of course, your own country, Pakistan?
Okay, in Pakistan, we have two main big issues for our people who use drugs and inject drugs. Their main issues are more than half wants to quit drugs, but we don't have access to appropriate treatment, opioid substitute therapy, methadone, or buprenorphine. In Pakistan, naloxone is available, but that is available only at healthcare settings, at the accident and emergency. For example, a injecting drug user get accidentally overdosed, they have to take the person to the accident and emergency. When they will simply call to the police, they will say that, excuse me, this person has taken the overdose. This is a police case. This is not a healthcare settings case. There is a problem, so many problems, like a legal problem, religious, social, cultural, taboo against sex workers, same-sex relation, drug use, and possession are threatening the region as low prevalence.
Yeah, well, you raised some very important issues there, that services are important, and they've got to be accessible, and they've got to be affordable, ideally free, because around half the people who are using would like to stop using, but that will often need some genuine support. Secondly, you raise the issue of naloxone. Now, my understanding is that the World Health Organization recommendation is that naloxone should be with anyone who is likely to witness an overdose, right?
Yes.
So it shouldn't just be something that's at the emergency clinic if you manage to get there. It should be with those who may witness it. You know, we owe it to our fellow citizens, those people who use drugs, to ensure that they can, live, and that they can live a life of dignity, not a life of stigma and discrimination, which is unfortunately so often the case. Now, I'm conscious that in Pakistan, a number of years ago, there was a huge decentralization of responsibility. So I assume you have to go, provincial government by provincial government to get these things done. You have to go to Sindh, you have to go to the Punjab, you have to go to the Northwest Territories, etc. But at that level, I think there should be very strong advocacy with the health ministries and ministers to get naloxone out where it's needed. Secondly, they need to be persuaded of the importance of harm reduction approach. Now, the bigger campaign, and this can be hard where countries are just used to locking people up, is to stop the criminalization of the drug users, and to say this is not fundamentally a criminal issue. This is a social and a health issue. We have to face the reality that in human history, human beings have always looked for some kind of substance which will take them out of their reality. In Western society, it's alcohol. In the First World War, in the trenches, it was tobacco. I understand in India, in the traditional Hindu ceremonies, a couple of times a year, ganja and marijuana is used. I mean, look, what is the point of saying that these things are somehow strange? They're not strange. They've always been around. So let's deal with life and reality. The use of these things should not be a crime. People need to know what they're getting into, but above all, our responsibility as a society is to keep people alive, to keep them healthy, and uphold their rights and dignity. So that's obviously a longer conversation where countries are very used to repressing and locking up, because far too many people are locked up for what you might call as a victimless crime. Who else is it hurting? Who else is it hurting? Why do we lock people up for using drugs? I don't get it.
Like in Pakistan, we have 99 prison, but not a single appropriate treatment center. They are not giving a choice to the person. They're not saying that, okay, we find you with the drugs. Okay, you have two choices. Go to the prison or go to the treatment center. But no, there is only one choice. Go to the prison. But they should give them a choice.
Absolutely. And that's why human rights-based approaches to these issues are always best. And
Yes.
It's certainly the approach the Global Commission on Drug Policy advocates. And let's just keep building a coalition for change and supporting the efforts of networks like your own
Yes.
to promote more enlightened human rights-based policies
Yes.
for everyone. Thank you.
Yes. Thank you, Mom. It's my honor. I'll talk from you, and I really learn again from you.
Thank you.
Thank you, Zeeshan. Thank you, Helen. Thank you all for watching. Hope you have enjoyed the series. And to learn more about the Global Commission's work, follow us on social media and go to our website. Thank you.